What are your thoughts on medically assisted death?
My grandma was 89 and wasn't dying of anything in particular. She didn't have cancer or dementia or anything, but her memory was slowly failing and her body was generally falling apart from old age and a leg injury from 50 years prior. She had been a widow for 14 years. She was lonely and in pain all the time, and her family lived across the ocean, so we couldn't see her as much as we'd want to. There was nothing actively killing her, but she did not want to be alive anymore. She wasn't depressed, just old and in pain and ready to be done. She was able to go to a place in Switzerland, with all 4 of her children, and take a pill to end her life while her children sang to her and she looked out at the mountains. We all got to say goodbye to her and she got to be completely in control of the end of her life. I can only hope that if I am ever in that situation, then world will be kind enough to let me close my own exit as beautifully and peacefully as my grandma did.
As sad as losing a loved one may be, this is beautiful. I can't see how coming to peace with the world, being with family and witnessing a gorgeous last bit of scenery could be argued. Thanks for sharing. I wish my grandma could have had the same. Instead, we could only give her water by sponges and watched her in fear in a dimly lit hospice room. Who knows how many more poor souls were forced to meet the same fate, just in that room alone. Edit. Y'all are making my legitimately cry right now. I've been on Reddit for about 8 years now, remade a while ago, and I've truly never felt this kind of empathy from internet strangers. In 2014, I wrote a paper on PA for my final exam for Eng 102 even before my grandmother passed. I have always felt strongly about this topic, and it makes me sad as a human to hear about the suffering of other families. I genuinely appreciate all of the responses. Honestly, these experiences need to be shared. It is downright inhumane to experience what your families has gone through, and I resonate with all of you. A little extra backstop some of you will relate to. My parents were divorced when I was 8, and from there on my great-grandma legitimately became the mother for my brother, 3 at the time, and I while my mother was out getting high. She was just like some of the mothers others have mentioned, leeching off of other men to get by and get high, never paying child support. Meanwhile, my grandma was using her effing social security check to make us corned beef and cabbage for our birthdays. She absolutely deserved to go with dignity, and so did your parents, grandparents, and quite honestly, yourselves. Thank you all for sharing.
I just went through this with a good friend in Canada. He had a glioblastoma, and was given 3 to 6 months to live. Ultimately he lived for 15 months, but he wanted to be sure he could end his life when things got bad for him, so he made the necessary preparations. I'd long known he'd made these plans. I wasn't sure how I felt about it. But as I was caring for him for the last 6 weeks of his life, I got to witness the process firsthand. Long story a bit shorter, towards the end my friend could no longer walk or speak. He could understand everything you said to him, but he couldn't find the words to reply intelligently. In his frustration he made it clear that he was ready. So we explicitly asked him if he was ready to die. He said yes. The next day 2 nurses came to his home. They talked to him and confirmed that he wanted to end his life. So, while sitting in his favorite recliner, they put in an IV. His immediate family and I sat with him. The nurses administered medication that made him fall asleep. Then they administered a second medication that stopped his breathing. In less than 5 minutes he was gone. I don't know if I'd have the courage to make the decision my friend did, but I didn't experience his suffering. Being present for him as he ended his life has convinced me that having the option to end your life on your own terms is the absolute right thing to do. There's no reason someone should have to continue to suffer when they know all they have to look forward to is more suffering. I'm very grateful that my friend had the option available to him. Had he been in my state in the US, that wouldn't have been possible. But it should be.
I've posted a few comments elsewhere in this sub, but I wanted you to know that your story about your friend's journey was meaningful, and described the process sensitively. Some people commenting here really have no concept of the magnitude of this issue. Thank you.
Mercy to those in pain.
This was a while back in Western Europe. My friend's dad had terminal cancer and was in severe pain, but the doctors would not give him increased morphine because that could trigger an addiction. In a terminal patient, he suffered needlessly until the very end.
My grandmother passed away last week with a medically assisted death. She had cancer that had spread to her brain, and was given a few weeks to a few months to live. From what family members said, she was deteriorating fast. She made the decision to have the procedure done as she wanted to end her time here with dignity. The appointment was made, doctors consulted, and paperwork drawn up. 10 days later 2 medical professionals came by her house where she was spending time with her children. It was done quickly and comfortably. Nana left peacefully on her own accord, in the comfort of her own home, and while she was still more or less herself. It was very strange to have a time and a date looming, but it also allowed me to set aside that time to be alone and hold a small vigil of my own. I'm currently in another country, and couldn't get back. She lived in Canada, where this service has recently been made more accessible, and I'm all for it. If it helped my Nana, it could help so many others.
So it's okay to do it in Canada? My uncle was diagnosed with Parkinson's and he was about to do it too. I think in that time it was only done in Sweden or something like that, but the doctors wouldn't let him. Now he cannot go to the toilet by himself, he cannot take his own medication, he needs special care nearly 24/7. I think he would be better off with medically assisted death. Skeptical smiley face. Edit. Made a mistake, it's Switzerland, not Sweden. Sorry.
It should be a right for every human to choose when terminal. We euthanize our pets but not our loved ones. We allow our loved ones to suffer miserably at the end of life. I was a hospice nurse and saw the suffering firsthand. It is inhumane to allow that.
My cousin died from a brain tumor and wanted to be at home, with her family, when she died. Her last 3 days, she lay begging someone to kill her because of the excruciating pain she was in. It was sheer torture for her, her family and her hospice nurse. I have a degenerative brain disease and would very much like to die with some dignity left, so I'm all for it.
Terry Pratchett's Shaking Hands with Death is an excellent talk on this. Link. Also, who by very slow decay, link. Greater than when you were young, you would go to institutions and gradually gather letters after your name. BA, MD, PhD. Now that you are old, you do the same thing, but they are different institutions and different letters. Your doctors will introduce you to their colleagues as Mary Smith, COPD, PVD, ESRD, IDDM. With each set of letters comes another decrease in quality of life. Greater than at first, these sacrifices will be minor. The COPD means you have to breathe from an oxygen tank you carry around wherever you go. The PVD will prevent you from walking more than a few feet at a time. The ESRD will require 3 hours dialysis in a hospital or outpatient dialysis center 3 times a week. The IDDM will require insulin shots after every meal. Not fun, but hardly inconsistent with a life worth living. Greater than eventually these will add up beyond your ability to manage them on your own, and you will be sent off to a nursing home. This will seem like a reasonable enough idea, and sometimes it goes well. Other times it gives you freedom to develop a completely new set of morbidities totally unconstrained by what a person in any other situation could possibly be expected to survive. Greater than you will become bedridden, unable to walk or even to turn yourself over. You will become completely dependent on nurse assistants to intermittently shift your position to avoid pressure ulcers. When they inevitably slip up, your skin develops huge incurable sores that can sometimes erode all the way to the bone, and which are perpetually infected with foul-smelling bacteria. Your limbs will become practically vestigial organs, like the appendix, and when your vascular disease gets too bad, one or more will be amputated, sacrifices to save the host. Urinary and fecal continence disappear somewhere in the process, so you're either connected to catheters or else spend a while every day lying in a puddle of your own wastes until the nurses can help you out. The digestive system isn't too happy either by this point, so you can either have a tube plugged directly into your stomach or just skip the middleman and have an IV line feeding nutrients into your bloodstream. Greater than somewhere in the process your mind very quietly and without fanfare gives up the ghost. It starts with forgetting a couple of little things, and progresses until you have no idea what's going on ever. In medical jargon, healthy people are alert and oriented X3, which means oriented to person. You know your name, oriented to time, you know what day per month per year it is, and oriented to place, you know you're in a hospital. My patients who have the sorts of issues I mentioned in the last paragraph are generally alert and oriented X0. They don't remember their own names, they don't know where they are or what they're doing there, and they think it's the 1930s or the 1950s or don't even have a concept of years at all. When you're alert and oriented X0, the world becomes this terrifying place where you are stuck in some kind of bed and can't move and people are sticking you with very large needles and forcing tubes down your throat and you have no idea why or what's going on. Greater than so, of course, you start screaming and trying to attack people and trying to pull the tubes and IV lines out. Every morning when I come into work I have to check the nurse's notes for what happened the previous night, and every morning a couple of my patients have tried to pull all of their tubes and lines out. If it's especially bad, they try to attack the staff, and although the extremely elderly are really bad at attacking people, this is nevertheless unacceptable behavior and they have to be restrained, i.e. tied down to the bed. A presumably more humane alternative sometimes used instead or in addition is to just tee you up on all of those old-timey psychiatric medications that actual psychiatrists don't use anymore because of their bad reputation. Greater than after a while of this, your doctors will call a meeting with your family and very gingerly raise the possibility of going to comfort care only, which means they disconnect the machines and stop the treatments and put you on painkillers so that you die peacefully. Your family will start yelling at the doctors, asking how the hell these quacks were ever allowed to practice when for God's sake they're trying to kill off grandma just so they can avoid doing a tiny bit of work. They will demand the doctors find some kind of complicated surgery that will fix all your problems, add on new pills to the 13 you're already being force-fed every day, call in the most expensive consultants from Europe, figure out some extraordinary effort that can keep you living another few days. Greater than Robin Hanson sometimes writes about how healthcare is a form of signaling, trying to spend money to show you care about someone else. I think he's wrong in the general case. Most people pay their own health insurance, but I think he's spot on in the case of families caring for their elderly relatives. The hospital lawyer mentioned during orientation that it never fails that the family members who live in the area and have spent lots of time with their mother, father, grandparent over the past few years are willing to let them go. But someone from 2,000 miles away flies in at the last second and makes ostentatious demands that everything possible must be done for the patient. Greater than your doctors will nod their heads and tell your family they respect their wishes. It will be a lie. Oh, sure, they will carry out the family's wishes, in terms of continuing to provide the care. But respect? In the cafeteria at lunch, they will, despite medical confidentiality laws that totally prohibit this, compare stories of the most ridiculous families. I have a blind 90-year-old patient with stage 4 lung cancer with brain mets and no kidney function, and the family is demanding I enroll her in a clinical trial from Sri Lanka. Oh, that's nothing. I have a patient who can't walk or speak who's breathing from a ventilator and has a anoxic brain injury, and the family is insisting I try to get him a liver transplant. Greater than every day, your doctors will meet with your family another time, and eventually, as your condition worsens and your family has more time to be hit on the head with a big club marked reality, they will start to relent. Finally, they will allow your doctors to take you off of the machines, and you will be transferred to palliative care, whose job I do not envy, even though every single palliative care doctor I have ever met is relentlessly cheerful and upbeat, and this is a total mystery to me. Greater than, and you will die, but not quickly. It takes time for the heart to give up, for the lungs to fill with water and stop breathing, for the toxic wastes to build up. It is generally considered wise for the patient to be on epic doses of morphine throughout the process, both to spare them the inevitable pain as their disease takes their course and to spare their family from having to watch them. Greater than, not that they always do. It can take anywhere from a day to several weeks for someone to die. Sometimes your family wants to wait at the bedside for a week. But a lot of the time they have work and things to do. Maybe they live thousands of miles away. You haven't recognized them in years, you haven't spoken a coherent word in months, and even if for some reason your brain chose this moment to recover lucidity, you're on enough morphine to be well inside the borders of La La Land. A lot of families, faced with the prospect of missing work and school to sit by what's basically a living corpse day in and day out for weeks just to watch it turn into a non-living corpse, politely decline. I absolutely 100% cannot blame them. Greater than, there is a national volunteer program called No One Dies Alone. Nice people from the community go into hospitals to spend time with dying people who don't have anyone else there for them. It makes me happy that this program exists. Greater than, nevertheless, this is the way many of my patients die. Old, limbless, bedridden, ulcerated, in a puddle of waste, gasping for breath, loopy on morphine, hopelessly demented, in a sterile hospital room with someone from a volunteer program who just met them sitting by their bed.
We let people die in fear and pain, but not animals. The last 6 months of my mum's life were exactly how she didn't want to live: confused, incontinent, immobile. I longed for there to be a legal way to end her suffering. She made it very clear to me during her life that this was not the way she wanted to go. I'm an RN, and should make it clear I've never assisted ending anyone's life, but I've wanted to. Medically assisted death doesn't mean more death, just less suffering.
I've worked in nursing homes, there's things worse than death and there's a lot of money in it.
As someone who has stage 4 cancer, I am in favor of having the right to die gracefully. As someone else with stage 4 cancer, when the time comes I hope to get to make that decision as well. Hope you're doing okay.
If it's good enough for my dog, then it's good enough for me.
Seriously, and unironically this. I won't even allow my dog to suffer at the end of my life. Why can't I make sure I don't suffer, either?
If you're not allowed to legally arrange the end of your own life, is it actually your own life?
I once read about a man, healthy, but he carried a cyanide pill with him wherever he went. When asked about it, he would say, "A prison becomes a hotel when you have the key."
Full support. People should have a choice to die with dignity and on their terms.
Doctor here, I agree.
I've worked with hundreds of dying patients at this point. I've seen suffering that is incomprehensible. There is literally no bottom to what a human can go through. It is endless and all-consuming. What's worse is in the hospital we have become quite proficient at prolonging suffering. If family members want their loved ones to keep going because they cannot accept their impending death, our hands are almost always tied. Do everything. So we do. We shove tubes and drains in every hole. You lie in agony for days, weeks, months, years. Your body can be kept alive long past its expiration date. It will literally start to rot, but you can prolong the function of vital organs, and so that person must remain trapped in a meat prison. The end is always the same, it just takes longer. It is more horrific than anything you can imagine. All because Western cultures cannot face death collectively and often exist in a state of denial about it. Furthermore, often loved ones feel if they are the ones to say stop, they're killing their loved ones. Others get concerned about the religious implications, as if some great deity would cast judgment on them for not keeping their family member in a state of purgatory for as long as possible. So to answer your question, after years of taking part in that, yes, I support euthanasia. I think our threshold for its use should be very low. I see death as an inevitable part of life, and one of my greatest joys is being able to help someone pass without pain and in peace with their dignity. Anyone who says otherwise can come hang out in the ICU for a few weeks. They can change the dressings, they can look these people in the eye and tell them this must continue, that some arbitrary bullpoo rationale is good enough to keep this going.
Full support. People shouldn't be forced to spend their last days in extreme pain. They should be able to choose to die with dignity.
I just watched my bedridden granddad finally die after 3+ years of dementia, cancer, and UTIs. I fully support medically assisted death, dying with dignity. He and others like him don't deserve that horrific, painful end.
Thank you for watching. We upload new videos every day, so be sure to come back for more fun. Please consider liking and subscribing if you enjoyed the video.